New tonight at 6, we're closing out Colorectal Cancer Awareness Month, a time to bring awareness to the disease. It's the second most common cause of cancer deaths in the entire country. But as KLTV7's Christine Guevara reports, there are things you can do to be proactive.
Colorectal cancer, also known as colon cancer, is a growth of cells called polyps that forms at any part of the colon or rectum.
There are some risk factors such as family history, certain diseases like inflammatory bowel disease that can increase someone's risk.
Dr. Annie Lynn is a gastroenterologist with UT Health. She says symptoms will not be obvious during the early stages. Those signs begin to show once the cancer has advanced. Those include changes in bowel habits, abdominal pain,
anemia or GI bleeding, weight loss. If it becomes too large, people could notice constipation or just nausea and vomiting from the obstruction from the cancer.
The disease is more common for those ages 50 or older. The American Cancer Society says it's expected to cause more than 53,000 deaths this year. However, there are preventable measures thanks to screenings. Doctors now recommend people begin colonoscopies at age 45.
When we do colonoscopies, we're able to find small polyps, which are precancerous lesions, and we can take them out, and that can prevent the polyps from growing into colon cancer, and that'll save many people from having to be subjected to surgery, chemotherapy, and radiation.
Dr. Lynn also recommends people talk with their primary care physician if they are at an increased risk. One may be qualified to get screened earlier. Christine Guevara, KLTV 7 News.
Health experts are also seeing an uptick of cases among younger adults. They tell us there's not a definite cause, but it could possibly be linked to a rise in obesity rates and diets rich in processed foods.